are miseducated and say that because that person is lazy or because they eat so much sugar or drink soda. None of those things have anything to do with the cause of diabetes. For some persons, such as children, we used to call it juvenile diabetes, but now we call it type 1 diabetes. This diabetes is caused by our bodies. Literally, our pancreas is not functioning properly, our beta cells are not working, our body is not producing insulin to make use of the sugar that our body is taking in. Hence, we have diabetes type 1. Type 2, we are producing insulin, but our body is not using it correctly, right? So this can happen over a period of time. These are the persons that are able, if they are diagnosed as pre-diabetic, to avoid the diagnosis of diabetes type 2. What we are seeing is diagnosis of diabetes type 2 in children such as 10 and 7 years old because of how our society has changed. Next, we have gestational diabetes. Gestational diabetes is brought about because the placental hormones are not accepting of the insulin. It causes the insulin not to work as it should. So we have gestational diabetes. Last but not least, we have late onset adult diabetes, which is highly misdiagnosed. This diabetes is from our system, autoimmunity, nothing else. I have heard of persons having a virus, their pancreas was attacked, and they leave the hospital as a diabetic. We have to be clear in our communication with our physicians so they can understand what is actually going on with us, our signs and our symptoms, so we can receive the proper diagnosis. There are a lot of patients that are the late onset adult diabetic that are receiving the improper diagnosis and being treated wrongly, which, as we both know, can cause damage over the long run. No matter what type of diabetes you have to be careful. Diabetes affects each and every body system, from your hair to the sole on your feet and everything in between, especially your heart and your vascular system, and kidneys. All of these things are important to monitor. So when you check your blood sugar, it's good to keep record to know your number, right? When you know your number, you know what your body can tolerate, and then you can start to look for changes in other areas. Most definitely, diabetics want to monitor their limbs, not only for discoloration, but for numbness, tingling, pain. This summertime, a lot of people may be going outside without their shoes. They may be going to the beach without their shoes. If you're a pre-diabetic or a diabetic, it's very important that you have a covering on your foot, because you don't want to have an injury to your foot that could turn into a wound. Elevated blood sugar will cause you not to heal properly, which could turn into dangerous tissue, if you will, necrotic or gangrene tissue, and then possibly an amputation. We also want to be mindful of our blood pressure while we are diagnosed as diabetics. And I don't know if I said that appropriately, but blood pressure is key. Because we have the extra blood sugar running through our veins and our vessels, sometimes a little sludge, if you will, which is actually sugar that is lipid, the fat, will build up in our veins and our vessels. This will contribute to loss of blood flow or small blood clots that could cause other injury to our bodies.